Hey you guys, this is Dr. West with the daily dose of vitamin H. Vitamin H is not a real vitamin, it's actually vitamin hope. And I'm really excited that I'm here with one of our fantastic patient outcomes. This is Courtney, and I've asked Courtney to give a little overview of what happened in the office. And it's really cool because on our update sheet today, she said that she's 98% better. And what was interesting about that is she said, I never thought that I could feel good again, right?
Yeah.
Because it was kind of a rough roll.
Yes, it was.
So anyway, so Courtney, let's work back just a little bit. You first came to the office because of
Lyme disease.
So she had Lyme disease at first. We did some treatment interventions. We actually got you pretty healthy.
Mm-hmm.
And then we had a big setback. What was the setback?
The car accident.
So we had a major trauma in November 2014.
Mm-hmm.
And what happened was, and one of my hypotheses, and there's actually some studies on this, is that Lyme disease actually loves manganese. Manganese is a really important mineral for ligament health. And so that's why with patients that have Lyme disease, why their ligaments, we have a lot of joint problems, is because we don't have very healthy ligaments. And it was aggravated by this sudden acceleration, deceleration injury, or a whiplash type injury. And so tell me how you felt after the accident.
I had some sharp pains in my neck. And it was about 5 days later when I felt some pulling, or I felt like someone was just ripping my head from my shoulders and just kind of pulling me apart.
And it was rough.
And it was horrible.
And tell them what you used to have to do about your neck.
Like when it was feeling that way,
right.
I would like push my head against like my mattress to feel like I needed to push like my body back together again.
And a lot of times when I walk into work on her, she'd be like this.
Yes.
And she'd be like, I have to.
Or I'd be holding
head
like this, and I'd have to like rest my head on my hand. Yeah.
So, Courtney, we did, we helped with the immune system. We put you on a ligament program. We started doing some specific vitamin injections, and then what happened?
I started getting function back in my neck and
started getting function.
Strong muscles, I guess, neck muscles back again.
Strong muscles, and we did, how many treatments was it?
4.
4 treatments.
And we thought we would need like 8 or
yeah,
10.
Initially I was like, I don't know how many it's going to take, but she responded phenomenally. So the bottom line about this story is that when you have a chronic soft tissue injury, a car accident, trauma, etc., there is a really, really cool, effective way to go right to the source, right where the sore spots are, do some vitamin procedures, and we just had a phenomenal outcome. It was so cool to see her update sheet today. And I've been asking her for a couple of visits, hey, would you give me a testimonial? And she's like, hey, I will as soon as I look good. So, Courtney, if anybody's looking about this and considering treatments at the office, either for arthritis or Lyme, what would you tell them?
I would refer them 150%.
150% referral. And is it okay to put this on social media on Facebook?
Sure.
Okay. So you guys, this is Dr. J getting ready to sign out. A wonderful patient outcome with the chronic Lyme that we were able to help resolve, and also the ligament tendon injuries from car accidents respond really, really well to effective vitamin therapy that we have at the office. This is Dr. J and Courtney signing out. See you guys later.